Stress. Good afternoon. Thank you all for tuning in. We are here again today for our regular 1 o'clock press conference. I will continue to do these every day at 1 o'clock so that everyone in Rhode Island can have access to the most up-to-date, most accurate news as it relates to Rhode Island and the coronavirus. We have heard feedback from some members of the press that you would like an opportunity for back and forth and to have some follow-up questions. It's an excellent suggestion, so I want you to know starting Monday we're going to have a system for you to be able to do that. I want to again thank the members of the media for going along with these changes. We are all kind of forced to do things differently, so we're doing our best. I appreciate your cooperation. I appreciate the suggestion, and on Monday we'll have an opportunity for you to ask questions and have follow-up questions answered. Today I'm sad to report another 2 deaths here in the state of Rhode Island as a result of the coronavirus, bringing us to a total of 14 deaths. We have 54 new cases that I'm reporting today in Rhode Island, bringing us to a total of 711 cases, and unfortunately we have 72 people in the hospital. As I've said from the beginning, we have our eye firmly on that hospitalization number because it's a certain number. You know, we still don't have enough testing happening, so the number of tests is somewhat inaccurate. We know there are many more people than 711 who have coronavirus. We know for sure there's 72 people in the hospital, and that number is climbing very rapidly. So we know we are in a rapid spread scenario here in Rhode Island. And what that means is we have to get even more serious about the rules we have in place around social distancing, staying at home, absolutely staying at home if you're sick, obeying quarantine if you're in quarantine, and washing your hands constantly for 30 seconds at a time. These sound simple. They are life-saving, and I need us all to do better because we are in the rapid spread phase of the virus. A few announcements. Earlier this week, I had the opportunity to talk to you a little bit about the full scale of our comprehensive response to corona. There's much talk about testing and N95 masks, but the response here in Rhode Island is much, much broader, more comprehensive and aggressive than just masks and test kits. And to that point, one of the things that we're working very hard on is making sure that we have enough hospital beds for when the surge really hits. And we've seen, if you look at the experience of states that are ahead of us, for example, New York City, they run out of hospital beds and the equipment for the beds pretty quickly once the surge hits. So we are fortunate in that we have some time now over the next few weeks that we can ready ourselves for the surge. So today I'd like to, we have, as I've said, we have the Army Corps of Engineers working with the National Guard over the past couple of weeks, going all over Rhode Island, evaluating dozens of potential buildings for additional hospital beds. And today I want to share the initial locations that we have settled on. At this point, we're planning on setting up a hospital at the Rhode Island Convention Center here in downtown Providence. Also setting up a field hospital at the former Citizens Bank building in Cranston, and also the former Lowe's building in Quonset, the Lowe's building in Quonset that is now vacant. So those are 3 areas that we have identified as excellent areas for hospital beds, nursing home beds, and alternative sites. And we are working very hard to make sure that they are ready. We believe that those 3 sites alone will get us well over 1,000 additional hospital beds. We have to also make sure that they are staffed appropriately, have all the necessary medical equipment for those additional 1,000 beds. I want you to know that work is well underway. General Callahan, who will be speaking in a few minutes, has done a masterful job making sure that we will be ready with the hospital beds. It's a Herculean effort to set up over 1,000 hospital beds in a convention center and in a former Lowe's warehouse, but we're doing it. We're well on the way, and I feel very confident that we're going to be ready. I also want to say thank you to the hospitals, the existing hospitals. They are all working hard and in collaboration with us on their own surge plans. So each hospital is going to have to expand the number of people that they can take care of. So every hospital now is putting plans in place so that they can take care of 10, 20% plus additional patients and have all the necessary equipment and staffing for when the surge hits. They're doing great work under difficult circumstances, so many thanks to the clinical leaders and nurses and executives at these hospitals who are working with us to get ready. I want to make another ask of the people of Rhode Island. We're getting the beds, we're getting the medicine, we're getting the ventilators, we're getting the medical equipment. We need people. That's an area where we continue to, as we look at the models, we still need help. We still need help. So I'm asking you again, asking you, begging you, imploring you, if you are a retired nurse, doctor, physical therapist, CNA, social worker, behavioral therapist, any healthcare worker with any healthcare experience, if you're retired, if you're only working part-time right now, if you're a recent graduate and not yet employed, we need to call you up. We need you to raise your hand to help us. By the way, it's not just volunteer capacity. We'll be able to pay many of you to do this life-saving work. I need you please to go to the website riresponds.org, riresponds.org. We can't do this without you, and so I'm asking you again, hundreds of you have already signed up. If any of you haven't and you have any capacity, riresponds.org, we need you. We need you to sign up now. A couple of other points. You have heard me day after day after day asking you to obey the orders around social distancing. And many of you are doing it, and I want to thank you because you're saving lives, your own life, your family, the lives of Rhode Islanders. Many of you are still not complying with the social distancing orders. So I want to be even clearer today. I have ordered a stay-at-home order for all of the people of Rhode Island. That means stay at home. That means work from your home. That means stay in your house. Go out quickly and occasionally, once a week, to the grocery store. Alone, not with your whole family. The same thing if you have to go to the pharmacy. If you have to work, go to work and come home, period. If you have to go to Massachusetts to work, go to work, come home, quarantine yourself in your house, and go back to work the next day. Why am I saying this? Because we still have data showing that we're not following the rules enough. Some of you have said to me, well, how do you know? Because I have the state police and local police checking in on big box retail shops, and there's still too many people there. Checking in on grocery stores, still too many people in the aisles close together, too many people in line, too many people at the deli counter close together. We also have some data that show us we're not even doing as well as some other states. There's publicly available data, public records show that Rhode Islanders are less compliant with social distancing than our neighbors in Massachusetts and I think even than the national average. Since we started social distancing, we've cut down on our movement by about 36%. The national average is 41%. So there's publicly available data that allows states to track how far the average Rhode Islander goes in a day. And the number of miles that the average Rhode Islander is traveling in a day is greater than what we are seeing in other states. That means we're not staying home enough. So I'm asking you to do better. We need to do better. Here's why we need to do better. Right now, I don't want to scare you, but I want to level with you. I'm going to tell you right now, we don't have enough ventilators to keep everybody safe if the surge hits sooner than we think, or if the peak is higher than we think. We don't. More people will die. We don't have enough hospital beds. We don't have enough doctors and nurses to take care of people. That's just a fact. So if you are one of those people out there who's still pushing the limits, thinks, oh, this is just like the flu. I get these letters. Governor, stop telling us to knock it off. This is just the flu. This is no big deal. I'm going to go to the grocery store whenever I want to. That's not right. That's not fair. And you're going to hurt a lot of people. And you know what else you're doing? You're making it practically impossible for me to get to the business of reopening this economy. There's a lot of people suffering right now. I hear from them every day. My mom's out of work. My dad's out of work. My restaurant, I don't know if I'll ever be able to reopen again. These stories aren't funny. They're heartbreaking, totally heartbreaking. I've been asked a lot by the media about modeling. I hope to be in a position on Monday to share where we are with respect to our modeling. But I want to tell you this. The biggest variable in the model is the level of compliance with the social distancing orders. So actually, it's not about the model. It's not about some fancy model. It's about you, the people of Rhode Island, doing the right thing every moment of every day so we can get through this safely and quickly. And I have mixed feelings. Half of me is very, very proud of you all because you're enduring incredibly difficult circumstances and doing it with kindness and with patience and with persistence and resilience. But to those of you who are still pushing the limits, I need you to stop. I need you to take this seriously. I need you to keep a distance between you and other folks. I need you to limit yourself to being with 5 people. I need you to write down at the end of the day who the 5 people were that you were in contact with. And most of all, I need you to stay home. And I'm going to keep saying that, and by the way, we're going to continue to enforce the quarantine and continue our enforcement until we get where we need to be. In a minute, Dr. Nicole Alexander-Scott will have some additional guidance as it relates to face masks. Every single day, we get more information. The scientists are learning more. We're doing our best to stay on top of this information and adjust our response accordingly. And so the doctor has additional guidance for the wearing of face masks so we can keep ourselves safe. I want to address child care. Unfortunately, and I mean that very sincerely, unfortunately today, I have to announce that we'll be continuing to suspend child care licenses through the month of April. It pains me to do that because as a working mother myself, I know how tough it is to have to work and not have good child care. I have been optimistic that we would find a temporary solution, but at this point, in consultation with the Department of Health and other experts and our child care providers, we just haven't found a solution which is safe. So what I'm telling you is we're not giving up. It's possible next week I'll have another announcement. We're not giving up. We're going to work continually and creatively. But so that you can plan, I'm telling you now, child care centers are going to remain closed for the month of April. We have provided access to care.com. Care.com, they have a special RI need page for Rhode Islanders. You can go on that site and find yourself a babysitter. Some of the babysitters are even free. They're volunteers. Thank you to the volunteers. And I guess I would just ask you to continue to work with your family and work in your own close social network to try to make it through at least a few more weeks without child care centers being open. And rest assured, we're working hard every day to figure out a solution to reopen some of these child care centers soon in a way that is safe for you and your kids and your family and the community. A minute on food delivery. Earlier this week, I announced a new service. That service is called ridelivers.com. It is a food delivery service. It's so far going incredibly well. It is, however, overwhelmed. I think in one day there were over 40,000 requests for delivery of meals. So let me say this. We need that service. We particularly need it for the elderly, and we need it for people who are in quarantine. The only way that people are going to be able to stay in quarantine effectively is if we provide delivery services for food and medicine. So what I would ask of you is that if you are young and healthy, or if you have somebody in your family who can go to the grocery store for you, or a neighbor, please do that. I hope over time, I know over time we're going to ramp up the RI Delivers service and we'll be able to have more capacity. But right now we're totally overwhelmed, and there are a lot of older folks who are in their home being told that it's a 2 or 3 day wait to get their groceries. So if you're young or if you have any other way to get your food, please do that. And please, for the moment, only use ridelivers.com if it's the only way that you can get food. Do not break your quarantine to get food. If you can't find someone to get it, go on ridelivers.com, and we'll do our best to get it there quickly. I want to take a second to address businesses, particularly small businesses. Not a day goes by that I don't hear from many of you about how tough this is. And my heart goes out to every one of you, and I really wish it didn't have to be this way. You're all putting on a very brave face, which I appreciate. You're being creative, you're being collaborative, and I know we will get through this. We will. We got through 2009, we're going to get through this. Every day I try to provide a little more guidance and a little more support. Today I want to note that as of 3 o'clock this morning, the new SBA Payroll Protection Loan Program is up and running. This is part of the federal stimulus response to the coronavirus. If you are a small business in Rhode Island, and if you are struggling and need access to capital, I want you as quickly as you can today to reach out to your banker, and if you don't have a banker, reach out to any bank or any credit union, and go ahead and file your application for the SBA Payroll Protection Program. There are many guidelines. Some of the guidelines are not clear. They're coming to us from the federal government. I'm asking for patience. I just talked yesterday to Senator Reid about this. I'm talking today to Senator Whitehouse and our congressman. They are working really hard with the federal government to streamline it. But call your banker or a credit union. If you don't have either, call 521-HELP, 521-HELP. That's the Commerce line. If you need a loan, if you need access to liquidity, today do an application for that new SBA lending program. Last note, I want to make a special note about mental health. In the same way that we're going to see a rise in the number of folks in hospitals, we are already seeing a rise in the number of adults and children struggling with mental illness. And it's going to get tougher as the economy, as more people are out of work longer. We're going to see more anxiety, more depression, et cetera. So I want to, again, highlight two referral services. A referral service for adults who need access to mental health is 414-LINK. That's our BH hotline. And for kids who are struggling, you can call Kids Link, 855-543-5465. I want to emphasize these are referral services. So you shouldn't expect to call that number and have a therapist on the other end of the line, but you can explain your situation and they will quickly as they can refer you to the best place for you to get help. Finally, I'm pleased to announce, related to that we've established a $5 million COVID-19 behavioral health fund at the Rhode Island Foundation. This funding is being made available by our insurance companies as a result of a state compliance review, and this money will all be dedicated to nonprofits doing mental health and behavioral health work in response to the COVID-19 crisis. That money will begin to be available on April 6th. You can go on the Rhode Island Foundation's website and apply for a grant. So with that, I'm going to turn it over to Dr. Nicole Alexander-Scott, and then we're going to hear from General Callahan, and then we'll come back for questions.
Thank you, Governor. Good afternoon. As has been stated, we have 54 new cases in Rhode Island. And as the governor also said, sadly, we have 2 additional fatalities. Our prayers are with those 2 families. One of the people who passed away was a nursing home resident, and one person was not. The nursing home resident lived at Crest Nursing Center in North Providence. As we have been reporting for several days, nursing homes remain the most challenging settings right now. There are roughly 65 cases at Crest among residents and staff. At Oak Hill Center for Rehabilitation and Nursing in Pawtucket, there are roughly 60 cases between staff and residents. There have been 5 fatalities, unfortunately, associated with Crest, and 2 fatalities associated with Oak Hill. There are 12 nursing homes with at least 1 case among residents. Beyond Crest and Oak Hill, Oakland Grove Health Center in Woonsocket has 6 cases. The other nursing homes all have fewer than 5 cases. The Rhode Island Department of Health and these nursing homes are taking dozens of aggressive measures working together. Residents with suspected or confirmed COVID-19 are being moved to private rooms, and nursing homes with cases are being instructed to limit the number of people who enter the resident's room to 1 staff person who can conduct the activities usually done by many other people. For example, homes are choosing 1 staff person who can bring in the food, assist with daily functions, and clean high-touch surfaces. This is an aggressive approach that we are taking after consultation with national experts and those in Rhode Island. The number of persons entering a room of a nursing home resident has a direct relation to the risk of spread of transmission. That is very similar to the stay-at-home order that the governor referenced earlier. Additional measures that we are taking are to treat the former roommates of confirmed cases similarly as if they have COVID-19 as well. These individuals, either confirmed cases or former roommates of confirmed cases, cannot be and are not being transferred to other units in the facility or to other facilities. That's what we refer to as cohorting, in helping to ensure that the cases are limited to a particular area or a particular wing to decrease the risk of transmission in a nursing home setting. Additionally, staff are aggressively doing temperature monitoring regularly of themselves while at work, including temperature checks every 4 hours. And active monitoring is also being done on all residents for symptoms. And of course, as is the case with all nursing homes now, all staff are wearing face masks or surgical masks, and no visitors are allowed into the nursing home facilities. These are just a range of the measures being taken. There are many, many more that are occurring. I wanted to provide a brief overview. I also want to take a moment to recognize the work, commitment, and hardship of the staff at these facilities, the managers, and the owners. Whenever we have unfortunate fatalities to announce, we also share our sincere condolences with the families of those who have passed. But these are also tremendously trying times for everyone who is a part of these nursing home communities. It's important for us to recognize them and their dedication too. With that, I want to also recognize the Rhode Island Healthcare Association. The association is doing its best to support member nursing homes and is working very closely with us to explore different options to respond to this current crisis. Separately, I want to reiterate a message that was shared yesterday. With Rhode Island's COVID-19 testing capacity now widely expanded, all Rhode Islanders who have symptoms of COVID-19 are urged to call a healthcare provider to get scheduled for a specimen collection so that they can be tested. It's important to note that symptoms of COVID-19 range very significantly. They can include fever, chills, cough, shortness of breath, muscle aches, which is referred to as myalgias, runny nose or stuffy nose, sore throat, headache, vomiting, or diarrhea. People with COVID-19 have experienced a range of different symptoms. We're continuing to learn from those throughout the country and are being deliberate about applying those lessons learned here. As we learn more about the virus, we know that some people with COVID-19 have only experienced 1 or 2 mild symptoms. Sometimes these symptoms just occur in isolation. Sometimes they are without a fever. It's important for us to continue to raise awareness for providers and the public that if you have any symptoms that are concerning for COVID-19, we have now expanded testing for all to be able to call your healthcare provider so that you can be assessed for testing. We have to emphasize the key is to call first. There should not be any healthcare facility that you just show up to, whether you're a healthcare provider, an urgent care center, or an emergency department. The expanded approach of testing all people with symptoms represents the significant change that the governor has been discussing as a critical component for us to pinpoint aggressive responses to controlling this virus. We know that COVID-19 testing in Rhode Island had previously been limited to the members of certain priority populations, those who are hospitalized, those from congregate settings such as nursing homes, and healthcare workers. We will continue to test those populations and want to make sure everyone is aware of the symptoms that you should call your provider for to be assessed. I also want to share one additional announcement. Going forward, we are now encouraging that Rhode Islanders can start wearing face coverings in public. Face coverings are different from regular medical masks, whether they are N95 face masks or other types of surgical face masks. At this time, people in the general public should not be purchasing or hoarding medical-grade masks, such as the surgical face masks or N95s. which are in short supply but are being addressed every day. Instead, we are encouraging that people can wear cloth face coverings. A cloth face covering is a material that can cover the nose and mouth. It can be secured to the head with ties or straps, or simply wrapped around the lower face. It can be made of a variety of cloth materials. A cloth face covering could be sewn by hand or can be improvised from household items such as scarves or t-shirts. So let's talk for a minute about why we are recommending this. The primary role of a cloth face covering is to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes. That may include people who have COVID-19 or some other viral illness, but may not yet feel those symptoms and may otherwise feel well enough to go out. We know the message is and will continue to be that if you are sick with symptoms, you need to stay home. Just because you have a cloth face covering does not mean it is acceptable for you to go out with symptoms. We want to do our part to limit the spread of respiratory droplets when people are in the community and in public. And we recognize that there may be times people are not aware that they have some of those mild symptoms. And so being able to cover yourself helps protect from other people being exposed. This face cover encouragement is a shift because of how atypical the COVID-19 symptoms are, as I discussed earlier. A very critical message to this is that cloth face coverings are not substitutes for any of the evidence-based approaches that we have been mandating as required. That is the social distancing, standing 6 feet apart wherever you are, washing your hands regularly and using hand sanitizer, and staying home when you are ill. Those are the proven approaches to work, and they must not be replaced by still going out when ill, not washing your hands, or not abiding by the social distancing requirements that we have expressed and that the governor has issued through the stay-at-home order. It's a good idea as well to wash your cloth face covering frequently, ideally after each use or at least daily. Have a bag or bin to keep cloth face coverings in until they can be laundered with detergent and hot water and dried on a hot cycle in the dryer. If you must rewear your cloth face covering before washing, it's important to wash your hands immediately after putting it back on and avoid touching your face. I want to emphasize, again, the critical importance of everyone following the stay-at-home order requirements. That is the determining factor, as the governor mentioned, to how we will be as a state and how our healthcare system will be able to respond in this. With that, I'm going to pass it on to General Callahan before we go to questions. Thank you.
Thank you, Dr. Alexander Scott and Governor. Good afternoon, everyone. I want to begin by saying that the people of Rhode Island have always been very gracious to those of us in the service within the Rhode Island National Guard, and I wanted to pause and just take a moment to express our organization's gratitude for our healthcare professionals and for the first responders who have been serving on the front line of this particular battle. It's been unbelievable to see their dedicated and selfless service to Rhode Islanders, and they are setting an extraordinary standard for all of us, and we thank you for that, and we are happy to be your backstop in this battle. So I'll share with you, as of today, the Rhode Island National Guard has activated over 700 soldiers and airmen, with the ability to activate approximately 300 more to assist in in supporting the state of Rhode Island, the Rhode Island Department of Health, and the Rhode Island Emergency Management Agency in response to the COVID-19 pandemic. In particular, in Rhode Island's, the Rhode Island Guard's 381-year history, this response is singularly the largest and most sustained mobilization of Rhode Island soldiers and airmen in support of a domestic crisis. As the Governor and Dr. Nicole have shared with you before, our 13th Civil Support Team was the first in the country to begin conducting remote swab sampling operations in support of RIDO. And because of their efforts and the team that within the interagency that is supporting them, they're in the vicinity of being able to sample over 900 people at this point. The Guard has embedded planning experts and liaison officers within RIDO and REMA and supplemented the hardworking staff at the RIDO call center and the contact tracing center. Guardsmen are providing health screenings to state employees and enabling them the state employees to continue their essential services to all of Rhode Island. In response to people generously reaching out to donate medical supplies and PPE, our airmen have been helping get that to the field. They've been receiving and distributing that where we believe it's needed most, and that's with our frontline responders and our healthcare providers. And it's been an important part of what we're doing. Right now, the National Guard is providing logistical support to Fema and RIDO to support supply warehouse operations. In addition, many of you are familiar with our missions at TF Green Airport, the train and bus stations, and in support of the Rhode Island State Police. And that's basically to help implore our public to pay strict attention to the Governor's executive order and just stay at home. These Guardsmen are working on behalf of RIDO to ensure the safety of the people of Rhode Island, which is and will continue to be our most important mission. As we speak now, our Rhode Island Guardsmen and women are working in partnership with RIDO and REMA and local towns, businesses, and hospitals in establishing the alternate hospital sites that the Governor mentioned earlier. This is a top priority for us and remains a primary focus for the next several weeks. As always, I will end with the fact that we could not do what we do without the support of our communities, our families, our friends, and employers, and all of the Rhode Island team that has supported us. This allows us to be always ready and always there to support and serve the great state. So thank you very much.
Thank you, Chris, and thank you, Dr. Nicole.
As we have each day, we're asking questions submitted by reporters from all over southern New England, and today we're going to begin with one by Steve Alquist of Uprise RI regarding the ACI. 2 correctional officers now have tested positive for COVID-19, and 71 inmates now scheduled for potential release. Is enough being done to reduce the prison population during this pandemic?
Thank you for the question. I think the answer is yes. Obviously, I look at data every day, and we change our response every day. But at this point, I want to thank the director at the Department of Corrections and all the correctional officers and the inmates for their cooperation. We have an excellent system in place. We've released dozens of people, which give us the opportunity to have better social distancing there. We've increased our cleaning, so I would say yes, but like everything, we'll continue to monitor it.
The next question is from Elizabeth Graham of PBN, and this was already said a little bit in your earlier remarks. How many coronavirus cases in the state are in nursing homes, and were any of the people whose deaths were reported today residents of nursing homes?
Since this pandemic began, we have a cumulative number of 120 residents that are positive cases associated with nursing homes. And as I mentioned, a number of the total deaths associated with nursing homes is 7, and that's 5 at Golden Crest and 2 at Oak Hill, sadly.
The next question is from Bill Bartholomew. Governor, we're getting reports of significant inadequate space in Newport's homeless shelters, while some Newport hotels have simultaneously raised their prices. Is there a way to remedy the situation, even if only at your urging?
Thank you for the question. I was not aware of that. Certainly not that local hotels are raising their prices, which is utterly unacceptable, and I will look into that. We have commandeered a hotel in Warwick in order to quarantine homeless folks, and we will continue to work hard, and I'll especially focus on Newport now that I have that report.
Next question is from Tony Mendez at Porter 102.1. What measures are being put in place for WIC recipients who cannot buy groceries because the products that qualify as WIC approved are not available because markets are sold out of those items? I understand Texas made changes to their program.
So we have increased the amount of money that we are putting on people's EBT cards, and that's on account of some of the federal stimulus money. So about half of Rhode Islanders received an increased amount of money for food stamps. What you're allowed to use it on is, of course, regulated by the federal government. And at this point, there are shortages in many grocery stores. I will say that the grocery stores are continuing to have their stocks reshelved. And so I would just ask for a little bit of patience. If your item isn't there today, when you go back in a week, I think it should be there. All reports are that most grocery stores, particularly the bigger ones, are still able to restock their shelves. In addition to that, if there are items that you need, I know Family Service RI and 211 at United Way are providing resources for folks for extra food, extra wipes, extra disinfectant, and we want to make sure we obviously take care of the most vulnerable at this time. So 211 at the United Way or Family Service RI.
Next question is from Matt Allen of WPRO Radio. Governor, the heads of Lifespan and Care New England said today on WPRO that we are ready for a surge. You have said we are not. Can you reconcile the two different characterizations?
So I didn't hear what they said, but I'm quite confident we're on the same page because we talk pretty much every day. We are getting ready for a surge. We are putting plans in place to ready ourselves for a surge. But as I just explained, we are going to use the Convention Center and Citizens Bank building and the Lowe's building for an additional 1,000+ hospital beds. We do not have a single hospital bed in any of those alternative sites right now, so we are not ready. The same is true for Lifespan and Care New England. They have surge plans that they're putting in place, and they're doing a terrific job to do that. But if there were a surge today or in a week, we do not have the capacity. So we are getting ready, but the reality is this takes time, and you can't flip a switch to have, a couple thousand new beds in the hospital system available tomorrow.
The next question is for Dr. Alexander Scott from Kim Kalunian at Channel 12, WPRI. As we learn more about coronavirus, what are your concerns around asymptomatic transmission?
It has been unprecedented how much knowledge and information has evolved during this pandemic. And so knowing that, we are getting additional information about the ability of this virus to be transmitted in persons who either have no symptoms or are pre-symptomatic before they actually develop symptoms and the ability to transmit, as well as what I discussed earlier, the fact that symptoms can be so atypical, so unique. We are used to telling people that you will just have fever and cough or sore throat with respiratory viral illnesses, and we are seeing that that is changing. It can just be a headache, or just be fatigue, or vomiting and diarrhea and a little bit of muscle aches. So the ability to transfer that information to the public requires us to be flexible and to continue to emphasize that it is evolving, including the fact that symptoms may not always be present when transmission is occurring. And so raising awareness about that across the board is a critical focus for us now.
The next question is from Brian Crandall at Channel 10. What do you tell families of residents at Golden Crest and Oak Hill worried about their loved ones? Why do those facilities have such high case numbers compared to others?
We want all families of loved ones in nursing homes, one, to know how much it is evident to us in our engagement with the staff at the nursing homes that those residents of the nursing homes are their family too, and they want to be there to be able to support them. We know it is normal to have fears and concerns about what's going on. We have known from the beginning that this type of congregate setting increases the risk of transmission because people are in such close quarters in a nursing home setting, and staff have to do a tremendous amount of work across patients. So it's important for us to be able to make the shift that I spoke of earlier, coming up with creative ways to have one staff person do the work of many people entering a room so we decrease the number of different types of people entering a room. And I will say that this conversation is happening regularly with all nursing homes. There isn't anything differently that Golden Crest or Oak Hill has done compared to other nursing homes. It is a challenging setting, as I've mentioned, and there are precious people who are there that belong to various family members and that the staff are looking to care for. So we will continue to work hard with the nursing homes, all of them, including Golden Crest and Oak Hill, to respond to this challenge.
The next question is directed towards the governor from Kate Nagel of GoLocal. You mentioned of a stay-at-home directive today. How does that differ from the previous stay-at-home order? Is this a lockdown?
Yes. I'm sorry for any confusion. I was referring to the stay-at-home order, executive order that I signed a week or so ago. So that there's no new executive order that I'm announcing today, but the point I was making is that we just aren't seeing the compliance with the stay-at-home order that we need to see, and so I'm asking people to do better at staying home. So the only absolutely essential workers should be going to work, and all you should be doing is going to work and going home. You should not leave your house under any circumstances. If you are sick, even a little bit, if you have the sniffles, stay home. Anyone, even if especially if you're an essential worker. So it's just a re-emphasizing what the order is that I had signed the other day.
So it is not characterized as a lockdown?
No, I'm not even sure what that means. There's so many words flying around right now, but no, it's obviously not a lockdown. Look outside, you see cars everywhere. You can still go to the grocery store, you can still go to the pharmacy if you need to. There are essential workers that have to go to work, but for everybody else, you should be staying at home. That's the reason that I decided to close all non-essential retail. This isn't a time to go shopping for clothes and books. At least not in person. I would love it if you did that online with a local merchant because they need all the business they can get, but it's just a time to hunker down and stay at home.
Next question is from Gina M. Is there a plan to test all staff members and residents at every nursing home and assisted living facility? And how long would it take to get results from that?
So let me say a word about testing. In an ideal world, we would be able to do that. I have said that we wanted to be at 1,000 a day, and that's where we are. In an ideal world, we would be much higher than that. And in an ideal world, we would be able to do exactly that. We don't live in that world. We live in a resource-constrained world where every day is a fight with every other state and even the federal government to get the equipment that we need to do the level of testing that we need to do. On Monday, on a call with President Trump and the Vice President and the governors, we were told that each state would be receiving, right away, 15 high-throughput Abbott diagnostic machines. We have yet to see those, and I'm still trying to get my hands on those. Those are the kind of machines, rapid testing, that you could imagine us putting at nursing homes, at hospitals. So the short answer is we're just not there yet. We're testing as many people as we can. It is my hope that a week from now we'll be testing many more than we are today. And when we get there, we want to be testing as many people as possible, most especially in these nursing homes, most especially healthcare workers, and then immediately moving them to isolation if they are sick or positive.
Paul Parker asks, how many beds will we need? How many will we have?
Do you want to take that?
So in terms of the surge, there's two phases that we're kind of focused on right now. We have what the Lifespan and Care New England teams are putting together in terms of bed availability, and of course that all depends on what other types of cases that they are dealing with. In total, from post-hospital, or I should say going with the alternate hospital site methodology, right now we have over 1,000 that we are planning for. I would sense that based on some of the data points that need to be refined later in the week, we'll certainly get to a point where we'll try to double that availability. So that's where we are right now.
Next question is from Alexander Leslie of WPRI Channel 12. Do we know how many cases, or at least deaths, involve people with underlying health conditions?
We are collecting data along those lines. A larger number of the deaths, a larger proportion of the unfortunate deaths are in people with underlying health conditions. Another example of that I can relay is 57% of the unfortunate deaths are associated with residents of congregate living settings, which sometimes also connects to people who have underlying medical conditions. And we can continue to provide more details on that.
Brian Amaral asked, did the state meet its goal of 1,000 tests per day yesterday?
Yes, a tremendous amount of work is going towards making sure that we have the number of tests that are needed. We have worked very closely with primary care providers because that is who needs to be called in order to have tests performed. And we are continuing the very aggressive approach with nursing homes, healthcare workers, and hospitalized patients in addressing the number. So we have come very close to the 1,000 when you have the compilation of all of those approaches in place.
Next question is from a guest reporter. What, if any, additional resources or help is the state providing to the families of those who have died from COVID-19?
We are continuing to work with our health and human services agencies to help make sure that the supports that families need are available. It will obviously vary for each family, and we'll continue to engage with families as we need to make sure that they have the support that we can provide.
Governor, the last question for today's briefing comes from Tara Granahan. Are there any health insurers offering plans for those laid off or unemployed since the crisis struggling with prescription costs around $250 to $300 a month?
Yes, thank you for the question. It just drives home again how many folks are struggling right now because they've been laid off. So I would remind everybody that Medicaid is available. We took the Medicaid expansion, and you could call to see if you're eligible, because that is an option for folks who have been laid off. We have extended open enrollment at the HealthSource RI, so folks can go on HealthSource RI and purchase a plan that might be right for them, and some of those plans there could provide good options. I do want to go back and to end with a very important point about testing. It relates to what Dr. Nicole said and the 1,000 a day. And I would ask members of the media to help push this message. So for a long time, for 2 weeks, we were saying we didn't have enough testing capacity, and so we were having to limit the testing capacity to folks who were first responders, healthcare workers, in the hospital, et cetera. That isn't the case anymore. Because of a lot of hard work by a lot of people, we now absolutely have the capacity to do 1,000 or more tests a day, 1,000 or more swabs a day. General Callahan and his team has done a fantastic job. We have multiple sites around the state where you can get swabbed at a drive-through center. The state health lab is working around the clock. We have private clinical labs who are taking our samples. Our supply chain team has managed to get the supplies we need. So now the message is different, and I'm asking if you feel like you need to be tested, call your primary care provider. And if you're a primary care provider, don't be shy. Send folks. We are ready, we have the capacity, and we need to ramp up our testing. So I know that's different than what we've been saying, but right now we absolutely can handle over 1,000 a day, and we need to start seeing the referrals from the primary care providers, and we need folks not to be shy about calling their doctor if they're sick and wondering whether they need a test, because we're ramping up, and the more we test, the better off we'll all be. With that, I will say this. We are still reliant upon out-of-state labs, commercial labs, so please don't expect that you're going to get your test result right away. If you're a healthcare worker, if you're very sick, you'll get a quicker result, but if you're, an average Rhode Islander who feels they need to be tested, it could still take 2-3 days for you to get your results back. But I want everyone to know we're open for business for testing, so please, let's go ahead and get us those referrals so we can get more accurate data around who's getting sick, how many people are sick, and then getting those folks into isolation as quickly as possible. Thank you for your time. It's the weekend. It's a rainy day. It's a great day to stay inside, watch a movie, read a book, cook, hang out with your family. Stay in the house this weekend. If you do, everybody's going to be better off, and I'll think you're a hero forever. So thank you.
Thank you, Governor.